Morning, Mr. Chairman, Ranking Member Cummings, distinguished members of the committee. I want to thank you for the opportunity to testify about EPA's response to the drinking water crisis in Flint, Michigan. I want to start by saying that what happened in Flint should never have happened and can never be allowed to happen again. The crisis that we are seeing is a result of a state-appointed emergency manager deciding that that city would stop purchasing treated water that it had been successfully relying on for 50 years and instead switch to an untreated source for the simple reason that they wanted to save money. The state of Michigan approved that decision without requiring corrosion control treatment. Without corrosion control, lead leached from the pipes and fittings and fixtures in homes and businesses and industries, and it leached into the drinking water. These decisions are what resulted in Flint residents being exposed to dangerously high levels of lead. Now, under the Safe Drinking Water Act, Congress gives states the primary responsibility to enforce drinking water rules for the nation's approximately 152,000 water systems. But EPA has oversight authority. Typically, EPA has strong relationships with our states, and we work with them under this act. But looking back on Flint from day one, the state provided our regional office with confusing, incomplete, and absolutely incorrect information. Their interactions with us were intransient, misleading, and contentious. And as a result, EPA staff had insufficient information to understand the potential scope of the lead problem until more than a year after that water supply was switched. While EPA did not cause the lead problem, in hindsight, we should not have been so trusting of the state for so long when they provided us with overly simplistic assurances of technical compliance rather than substantive responses to our increasingly growing concerns. Although EPA regional staff repeatedly asked the Michigan Department of Environmental Quality to address the lack of corrosion control, we missed the opportunity late summer to quickly get EPA's concerns on the radar screen. That I regret. Since October, EPA has been providing technical advice to the city. Additionally, as part of the federal response led by the Department of Health and Human Services, an EPA response team of scientists, water quality experts, community involvement coordinators, and support staff have been on the ground every day since late July. The EPA team has visited hundreds of homes and collected thousands of samples to assess the city's water system. And we're encouraged by these test results. But our enhanced efforts with Flint will not cease until the system is fully back on track. Now, we've also been engaging Flint residents, visiting places of worship, schools, libraries, community centers, and senior living facilities to hear their concerns and share information. I have also taken several concrete steps at the agency to address some of the systemic issues raised during the crisis. I directed a review of MDEQ and its ability to implement the Safe Drinking Water Act for the very reasons that the governor has also so clearly articulated. I called on EPA's Inspector General to investigate EPA's response to the Flint crisis. No, we didn't cause it, but could we have acted sooner to correct the situation? I issued an EPA-wide elevation memo encouraging staff to raise issues of concern to managers and for managers to be welcoming of staff concerns and questions. Too much back and forth went between EPA and the state when it should have gone up so that we could have raised the red flag earlier. I also recently sent letters to every governor and every state environmental and health commissioner in the country asking them to join EPA in taking action to strengthen our safe drinking water programs, to ensure that they're looking and working with their own communities. Additionally, we're actively working on revisions to the lead and copper rule. The lead and copper rule was revised under the prior administration to streamline the monitoring and reporting requirements. We know that it needs to be strengthened. While the contours of this situation are unique, the underlying circumstances that allowed it to happen are really not. As a country, we have a systemic problem of underinvesting in environmental justice communities. And make no mistake about it, this is an environmental justice community. Not only are these underserved populations more vulnerable to impacts of pollution, but they often lack the tools and the resources and the voice to do something about it. That's what stacks the deck against a city like Flint. That's what creates an environment where a crisis like this can happen. In many areas across our country, water infrastructure is aging, antiquated, and several communities are severely underfunded, particularly low-income communities, which may have the most difficulty securing funds through rate increases or municipal bonds. This threatens citizens' access to safe drinking water, and we need to start having a serious conversation with Congress and others about how we advance the technologies and investments necessary to keep delivering clean water to American families. I'm personally committed to doing everything possible to make sure a crisis like this never happens. Having been to Flint, having met with the families, having met with faith leaders, having looked at where we're distributing waters, having worked hard to make sure that communities have the information that they need to stay safe. You cannot do anything but be personally committed. But we know that no one portion of government can do it alone. None of us can do it alone. We need the cooperation of all of our colleagues at every level of government and every branch of government and beyond. Thank you. I look forward to answering your questions.